This therefore means that our old people, while sleeping, should actually now reinforce their rooms. Because if gray hair has now become a drug, chances are that our old people will be sleeping only to wake up in the morning and your hair is not there.
The retrospective review of secondary data from 2011 to 2021 has seen the age of 12 to 35 years old substance-related persons with 641 case records extracted from in-person register from the hospital. The Chief Executive Officer of Living Plus Heavens Uganda, Queen Anita Nyati, who is also a PhD student, conducted the research on substance abuse, focusing on persons admitted at Arua Regional Referral Hospital Mental Unit. Nyati is a student of Heidelberg Institute of Global Health, University of Heidelberg, German, pursuing her PhD in public health. The research is related to youthful cat-related injuries in northwestern Uganda. While presenting the findings to the leaders in West Nile on Tuesday at the hospital boardroom, the findings revealed that the youngest person hospitalized at the facility is aged 13 years.
We only experienced in 2017, there was a drop. But from 2017, there has been a persistent increase in that age group. And the youngest person hospitalized was 13 years old. 13 years old. And 3.7% of the total that we reviewed were actually children. And when it says children, that's 17 below. Okay? And that should worry us as leaders.
The findings indicate that 3.7% of children are hospitalized due to substance abuse. 7.3% adolescents are hospitalized, with the highest number coming from Maracha district. The findings also revealed the 98.5% male are hospitalized due to substance abuse, with Arua City having the highest number of 62%. Maracha came second with 12% and Teregu third with 7.6% among other districts in the region.
And the group that we included were very particular. So this research that I'm presenting is for the group 12 years to 35 years. And so that means we've left out quite a big number out. This is just an iceberg of the issue about mental health. And we're able to extract about 641 records. These are 641 patients.
At least 566 persons were discharged, indicating 96%. 6 persons had self-discharge, indicating 1.5%, and 3 cases of relapse recorded from the facility. A total of 588 cases of persons were diagnosed with substance abuse. Of these, the highest came from the alcohol consumption, with 232 cases. Multiple substance abuse had 178, and substance abuse registered 178 cases.
The trend is that substance abuse is on the increase, and it's very important for us to appreciate that substance abuse is a growing cause of mental illness. I did say that there are other causes of mental illness, but substance abuse is one of the growing, so that means the potential is still more. And when it comes to hospitalization among psychiatric patients, it's actually one of the leading. And then there is early substance initiation. So if you have a 13-year-old already using drugs, it should worry us, because that means the burden is going to be bigger.
Marlon Avutia, the mayor, Aivu Division in Arua City, says a lot of young people abuse drugs on daily basis.
If you went to police now, police will give you a worrying statistics of 50 cases, because a drug addict will want to always take a drug, even when the addict himself is not working. So what is the option? The option is to go and steal, so that you can acquire, because all these drugs are being sold. By the way, for your information, I don't know whether on the list the Azangi was included. Now, the latest Azangi, you don't even need to consume it. You just get a seed and put in your shoes, and you put on the shoes. In the next 2 minutes, you are already intoxicated.
Azangi is a herb. In the childhood, it mostly grows around homesteads, behind kitchens. It bears fruit with some thorns around it. We used to comb our hair with it, like that. It is that herb. That thing is very, very dangerous. You got to learn. As said, you don't consume it. You only insert it in your socks or shoes down there. The students told us this thing gives you supernatural energy.
As solutions, as ways to address this, I think it is possible. The things that you have presented here, they are mind-blowing. They are some of the things I was thinking about. Just starting with engaging. Think of engaging. Just let's engage with these young people.
It was discovered that on average, a patient would stay for 3 weeks in the facility, with the longest spending 23 weeks. The data implies that 33.5% children and adolescents had multiple abuse among children and adolescents, affecting production, causing human resource gaps and parental responsibility. Report compiled by Robert Ariaka for the news.